Ms. Heard did not have PTSD, and there were also pretty significant indications that she was grossly exaggerating symptoms of PTSD when asked about them. There are 20 kind of core symptoms that somebody can manifest with PTSD. You don't have to have all of them. Ms. Heard initially said that she had, in the first question, you say, do you ever have this, before you get to the more nuanced follow-up questions. When I asked that first question on each item, she initially said, yes, I have that, to 19 of the 20 symptoms. That's not typical even of somebody with the most disabling form of PTSD.
I'd love to see how Amber Heard described her symptoms of PTSD. Rosebud. It would be quite hard to put your finger on it if you're not a psychologist, wouldn't it? You know, you'd be like, well, it sounds like bollocks. So for those of you who are following this Johnny Depp Amber Heard trial, this will surely be of interest to you. This psychologist's opinion, but albeit a very, very professional and well thought out opinion of Amber Heard's personality. Why is it important? Well, the first thing we've just seen there is, well, it's a damning testimony, no? She believes that Amber Heard does not have PTSD, which is what Amber Heard is claiming. She is claiming to have post-traumatic stress disorder. And not only is she claiming that Amber Heard doesn't have PTSD, but that she is actively seeking to make others believe that she does have PTSD. She's trying to manipulate people into thinking she is suffering from post-traumatic stress disorder, more so than a war veteran, more than someone who is severely disabled with post-traumatic stress disorder. I don't know if you've ever met anyone with PTSD, with severe PTSD, war veterans, things like that, you know, the deer hunter, where they can't leave the house, they're absolutely in shell shock, quite literally. The other takeaway from this testimony, which we're going to get into now, is that she believes Amber Heard is suffering from two different personality disorders. One of them is borderline personality disorder, which I already knew quite a lot about, and this other disorder, which is called histrionic personality disorder, which does sound quite a lot like narcissism. It's a damning testimony. It really is. We're going to get into it. As I said, I'm going to leave a link in the description so that you can see the full testimony of the psychologist, because it's really interesting. I'm going to look at what I felt were the most important things that she said, and I don't know. I think it's over. I think it's over for Amber Heard. I don't think her accusations were already, her stories were kind of full of holes. There doesn't seem to be any solid evidence for what she's accusing Johnny Depp of. There does seem to be quite a bit of evidence that she has been physically and psychologically abusive towards Johnny Depp. So this feels like just another nail in the coffin. I don't know if the final nail, but another one. There are several now. Anyway, let's get into the video.
Okay. You indicated you were talking about emotional reactivity. What, if any, emotional reactivity did you observe in your review? And let's do this one at a time.
Okay. So there were a couple indications to me. First, I can sort of think about it with the treatment records. So particularly Dr. Cohen-Connell's, am I getting the name right? I feel like for some reason in my mind I might have just reversed it. But Dr. Cohen's records, I did reverse it. He actually refers to this reactivity quite a bit, and to Ms. Heard's temper. And that temper, it's often branded, or being hot-headed, is really characteristic of borderline personality disorder. As is their very charming, personable nature. This is a disorder of contradictions. In Nurse Filati's notes, I thought there was something interesting. She references a night when they're out to dinner, I believe in London, and she provided positive reinforcement to Ms. Heard because Ms. Heard had been disappointed by a mistake made by the server, and it sort of references how previously she might have criticized the server or become upset by that. and that she didn't this time, and so that had been some sort of a step forward. And there was also an indication actually in Dr. Hughes's, Dr. Hughes is a forensic psychologist who had been appointed by Ms. Heard to conduct as an evaluation as well. In Ms. Hughes's interview of Ms. Heard disclosed that she had cut her arm in the past, which is a typical reactive type thing somebody with this diagnosis can do. It's one of the symptoms. And that's sort of all I can think of top of my mind from the treatment records. Moving into some of the declarations or deposition testimony, what struck me was Ms. Raquel Pennington's testimony. She's a former friend of Ms. Heard's, and she told a story about, I suppose, they were shopping for Thanksgiving accoutrements, something to prepare for Thanksgiving, and Ms. Heard struck her in the face, sort of out of the blue, which is, I thought was interesting, because that is one of those signs of borderline personality disorder where if a friend or a loved one isn't meeting your needs in that moment, people with borderline personality disorder can be very caring in their relationships as long as their needs are being met. They feel that their needs should be met when they want them met at a specific level, and if they're not, then that anger, that sense of harm causes them to react. So the striking Ms. Pennington, per Ms. Pennington's report in the declaration or the testimony, I thought was pretty consistent. And then Ms. Heard's own self-description.
Okay, we're going to, I'm going to ask you a question about.
Sure.
Okay. We've heard enough there. That's fine. It's like, so all of her doctors, her own appointed doctors and nurses, psychologists have all noted that she has these typical symptoms of borderline personality disorder. An ex-friend, clearly an ex-friend, not a friend anymore, got slapped in the face by her on a shopping trip out of the blue. She's unstable, clearly. If we are to believe all of these things, but why would her own doctors, why would an ex-friend, why would everyone be lying about her? I'm going to skip through the video a little bit now because there's a whole sort of 10-minute segment of the psychologist explaining what borderline personality disorder is. There are thousands of videos on YouTube explaining what borderline personality disorder is. I've watched hundreds of them. It's something I'm really interested in. I'm going to skip through that, but let's suffice to say that people with BPD are essentially very, very insecure, and they feel abandoned a lot of the time. They feel empty if people aren't essentially supporting them at all times, and they can often feel like somebody's personally insulting them when they arrive late and stuff like that. They're very changeable, very unstable. They don't have a real sense of who they are, so they tend to imitate the people around them. It's something I'm very familiar with. So I'm going to skip through that. She goes on to describe the other personality disorder that I wasn't so familiar with. It's histrionic personality disorder, and I think this is quite interesting, so I'm going to leave this bit in.
In addition to borderline personality disorder, I understand that you diagnosed another personality disorder. What's that?
So histrionic personality disorder, and these are really two sides of the same coin. They belong to the same cluster. We call these clusters. It's a way to organize personality disorders in that DSM. And this cluster is described as the personality disorders that are dramatic, erratic, and emotional. Okay, so unpredictable, but really having to do with emotions and relationships. They're very similar. Whereas I was saying that borderline personality disorder, a lot of the key features that you're going to notice are instability. When it comes to histrionic, a lot of the key features are going to be drama and shallowness. Similarly, with borderline personality disorder, there's this underlying drive of avoiding abandonment. With histrionic personality disorder, that underlying drive is to always be the center of attention. Because if you don't have that attention on you, it feels similarly to borderline personality disorder. You feel pretty empty. Like you don't have that sense of being or of value, okay? So whereas borderline personality disorder might have more of the visible reactivity if somebody seems to be leaving, with histrionic personality disorder, what you're going to see is extreme discomfort with not being the center of attention, extreme efforts to be the center of attention, and when they feel that they're not the center of attention, you will see some strange things, making up stories to try to get attention, often taking on a victim or princess role. Those two roles in particular are pretty consistent. Seeking caretaking. Borderline personality disorder is similar because with borderline personality disorder, these shifts of identity and the splitting, you might see somebody go from being, in the DSM it describes it as a needy supplicant of help, seeking the perfect caretaker, to suddenly being the avenger against injustice or thinking that their partner is a terrible person. With histrionic, what you'll see is somebody who wants to be the center of attention, has sort of that impressionistic speech, very flowery, very enthusiastic, but nothing's really being said. The moment your attention wears away, because they're so demanding for attention, that's when they might take the victim role or the princess role and even make up stories. Sometimes those stories are to bolster the victim role. Sometimes those stories are just to make them look more interesting or accomplished in their mind so that they can get respect and attention that way.
So I found that fascinating. I think I've heard of histrionic personality disorder before, but I would love to know how you distinguish that from narcissism, because it sounds like the same kind of thing. They need to be the center of attention. They feel like they deserve all of the attention, and if you aren't paying attention to them, it's because you've got something against them. If somebody gets more attention than them, they feel extremely jealous. I'd like to know the exact differences between a narcissist and somebody who has histrionic personality disorder. And I do think it's interesting. How can you be both histrionic and borderline? I don't know how. It doesn't seem like you could be the same thing, even though they might have similar manifestations. I don't understand how you could be diagnosed with the two disorders at the same time. She goes on here to describe a little bit more about histrionic personality disorder and about how they are quite seductive and try to seduce people, which again I found very interesting, and I'm going to leave in the video.
Is there a relation between histrionic personality disorder and attractiveness?
There is, strangely, and this is always one of the trickiest things to talk about, because how is that a symptom? But characteristically, people with this disorder are very, very interested in looks, but more importantly, they utilize their looks to get that attention, to get that respect that they're seeking. And so this type of a personality might be flirtatious with everybody. Characteristically, they actually couldn't even be subtly, and when I say flirtatious, I'm not talking overtly sexy, but kind of inappropriately flattering. Sometimes they act in a kind of a girlish way to be cute and to engender attention. And this will even occur in their therapy relationships as a way to sort of avoid getting negative feedback or criticism. Oftentimes they'll bring the therapist gifts or be distracting if they engage in therapy because they just don't want any criticism. They want the therapist to like them.
Again, this idea of a histrionic person being seductive and trying to seduce people, trying to, giving them gifts and stuff like that to sort of show that they are a good person, try to attract people to them. Again, I'm pretty sure narcissists do things like that as well. And I know that there's a distinction there with borderline personality disorder where they will genuinely believe, somebody with BPD will genuinely believe that the new person that they have met is fabulous, is amazing, that a lot of the time their latest partner is just the best person they've ever met. It's the love of their life, their soulmate, and then they arrive 10 minutes late for something and they're just the shittest person they've ever met, and they're an absolutely horrible person. And then there's the remorse and all of that, which I don't know if I left all of that in the video, but that's stuff that I know about BPD. Histrionic and narcissism, though, how do we distinguish? It's not very clear to me. It sounds like histrionic, bad, just shitty people, basically. I don't know. Yeah, that's the vibe I got from Amber Heard. Gotta be honest.
Does the intelligence of the affected person bear on the manner in which these disorders present?
Excuse me, I choked a little at my water. Yes, and I think one way to think about it that's probably a little more accurate than just intelligence is, in psychology, we would describe this more as sophistication. So street smart, so to speak. The way, for instance, I've had many clients who have borderline personality disorder who are messy and really clearly suffering, and they might be difficult and all over the place and yell at you in the middle of a session, but it's so it's not tailored. It's so much easier to work with because of that just openness and rawness of it, genuineness.
Gotta admire the camera work here as the psychologist is describing openness, rawness and genuineness, and it's just cut to Amber Heard's cold, emotionless face.
Sometimes you'll have a more sophisticated presentation. There are 9 symptoms and only 5 have to be met. So there are a lot of different combinations and different ways it can present. And sometimes you'll have more of a petulant version of this, where it really shows when you push the button and you're kind of, whoa, what was that? So somebody who's really productive, high functioning, successful, and you get to know them and you think they're fantastic because they're so interested in you too. And you might not realize it, but they're mimicking you perfectly. So you're really just kind of falling in love with this new friend who is being you. But then all of a sudden, you say something that they think is offensive, and you can't, even in your wildest thoughts, understand how that could have offended somebody, but their reaction is so strong that you kind of buy into it. Gosh, maybe I did say something offensive, and you feel bad about it. So that sophisticated version, they can be a little bit more calculated in the way they present. They tend to kind of hit you where it hurts a little bit more, and they can be actually very, very destructive.
So interesting, again, to just bear in mind what is being said about borderline personality here, which I just don't see as compatible with histrionic, because borderline, it seems like there is just genuine emotion behind somebody's borderline personality disorder, right? They feel it, right? And there might be more sophisticated levels of borderline personality disorder. They're better at mimicking other people and doing the right things and behaving themselves, generally speaking, most of the time. But then you just press their button in, as she said, in the wrong way, and you talk about something that they don't like to hear, you say something, you give an opinion that they don't agree with, and they just sort of explode. But there's a genuineness to it. So, but with histrionic, it doesn't seem, I don't know, it doesn't seem like it's quite the same. Let's carry on, because here we're actually going to hear what conclusions the psychologist made about Amber Heard. So very interesting now.
What conclusions were you able to draw about Miss Heard's sophistication from her testing?
Well, from her testing and from her presentation, she was very likable, but her testing in particular showed that she approached it in a manner that, remember I told you about those scales that are pretty neat. She approached it in a manner that very clearly minimized any psychological dysfunction, not just that, but really presented herself as free of any problems. And she did so in a way that was very sophisticated, not obvious, by responding to questions that most people might not notice were trying to detect that.
So this to me is absolutely key. Amber Heard is an extremely manipulative person, I think, and certainly according to this psychologist. At the beginning of the video, I showed you that the psychologist drew the conclusion that Amber Heard faked PTSD. So she answered a series of questions claiming to have all of the symptoms of PTSD, yet when she's doing a personality test to determine whether she's suffering from any personality disorder, she knows to answer those in a much more sophisticated way. So it's a complete lack of self-awareness, and at the same time a level of intelligence of thinking she knows what the right answer is in most situations. But these tests are extremely sophisticated themselves, and it seems like she's been caught out. You know, she has maybe on a very shallow level been able to manipulate people and make them believe that she's suffering from PTSD, and yet at the same time she's completely in control of her mental faculties. But that neither of those two things are true, it seems. She does have personality disorders and doesn't have PTSD. It's absolutely amazing that these people walk among us.
In addition to diagnosing Ms. Heard with these two personality disorders, did you form another opinion about Ms. Heard's mental status?
Yes, so go ahead.
If the answer to that is yes, I'm going to now ask you,
Okay,
what
yes,
was that?
I did.
Okay, what is it?
So in addition to looking for Ms. Heard's general mental status, any psychological issues that were present, I very specifically was assessing to determine whether post-traumatic stress disorder was present, and it was not.
How do you know that?
So first of all, from multiple information sources, right? So I was integrating the interview, my review of the data, the case records, other people's testimony, her treatment records. And then I also conducted, in addition to the MMPI-2 and looking at that data, I also conducted the clinician-administered PTSD scale, the CAPS-5, which is the gold standard PTSD assessment developed by the National Center for PTSD, shown to be valid, accurate for use not just with service members, but also with civilians, men, women, all genders, and also all ethnicities, and then also specifically for use in a courtroom setting.
So it's just your opinion, basically. Yeah, that's pretty convincing, I would say. Not good, not good.
Okay. As a result of applying those protocols, what did you conclude?
Ms. Heard did not have PTSD, and there were also pretty significant indications that she was grossly exaggerating symptoms of PTSD when asked about them.
How did you make that latter conclusion?
So one of the strengths of this test, as I mentioned, the important thing about any test used when you're doing an evaluation in forensics is to make sure that the person is responding accurately. And this test does that by not just asking people whether they have a symptom, but asking follow-up questions that draw out very detailed accounts of every single symptom of PTSD. And when you're really familiar with this disorder, which you need to be to administer this test, there are nuances in the way a person will describe their symptoms that have been shown repeatedly to indicate exaggeration or faking. There are also indications when somebody is clearly giving you a genuine response.
What, if any, symptoms of PTSD did you observe in Ms. Heard?
So there are 20 kind of core symptoms that somebody can manifest with PTSD. You don't have to have all of them. Ms. Heard initially said that she had, in the first question, you say, do you ever have this? Before you get to the more nuanced follow-up questions. When I asked that first question on each item, she initially said, yes, I have that, to 19 of the 20 symptoms. That's not typical even of somebody with the most disabling form of PTSD. When we eventually sort of dialed it down, she had 3 remaining symptoms. And having symptoms of any disorder is common for all of us. Some of us struggle with sleep. Some of us get anxious. It could be several different disorders. It could just be that you have this struggle in your life. But she had 3 specific symptoms that I scored as present. Off the top of my head, I might miss one, but one was sleep disturbance. So she reported that she has frequent nightmares. Another one was that she said that she tends to have a startle response. So if she gets startled or surprised, she tends to stay in sort of a hyper startle mode for quite a while. And that's consistent with a couple of things. It can be consistent with PTSD if other criteria are met. It's also consistent with childhood complex trauma, which is something that can occur when your brain is forming. If you constantly feel unsafe, if your parents are abusive, or if they're not present, if you're neglected, you can develop certain physiological responses that can stay for a long time in your life. So I noted that seemed like a very genuine, accurate account where she stays in the state of kind of hyper arousal, has a hard time calming down if she gets surprised.
So as you'll see now, that even this last shred of hope for Amber Heard seems to vanish in the testimony, in the opinion of the psychologist. The idea that maybe she doesn't have PTSD, but she is somewhat traumatized. She does have some sort of lasting stress symptoms that have come, that are a result of the trauma she experienced in the relationship with Johnny Depp. But as you'll see, the conclusion of this psychologist is that they were underlying issues that were around before she ever met Johnny Depp. Probably they came from her childhood. Yeah, this is it, I would say. I don't think... I don't know. Unless some damning evidence comes out in the next few days, I'm going to call bullshit.
You mentioned nightmares as well.
Yes.
Did she recount for you the nature of the nightmares?
So they were vague. She indicated that she has recurrent nightmares and that she feels as though she's being held down. And there was some conflict in that account, because even though that could be a PTSD symptom, it is fairly vague, but I still scored it as present. And in her initial treatment with Dr. Bonnie Jacobs, which I believe started before she began dating Mr. Depp, she had indicated to Dr. Jacobs, according to Dr. Jacobs's notes, that she was having repetitive nightmares back then and that they were related to her childhood trauma. And so that came up several times in the notes. Dr. Jacobs kept mentioning that.
Oh dear. So, of the 3 symptoms she may have of PTSD, one of them was already there.
Thank you. What is feigning?
Feigning is essentially faking or exaggerating symptoms that aren't present.
Does the CAPS-5 control for that?
It doesn't necessarily control for it. It can expose it by drawing out.
How does that work?
Because you're not just simply handing the person a checklist that says, here are all the symptoms of PTSD, why don't just check off the ones you have, which clearly if you're trying to look like you have PTSD, you would just check them all. The CAPS-5, because it requires them to describe in detail how they experience the symptom, where it shows up, what it looks like, what sort of examples they can give you, how many times it's happened in the last couple of weeks, how many times it's happened in the last month. By the end of each symptom, you've gotten a very good picture of a couple things. One, does it meet the definition of the symptom? Are they getting it right? Is this actually the symptom, or are they kind of confusing this with something else? Number 2, are they giving you very vague accounts? Are they giving you kind of a stereotyped idea of what the symptom is based on media or movies or something that actually is completely different from genuine experiences of this symptom? Or are they giving you a very genuine, heartfelt, sometimes minimizing, but it's ticking all the boxes. Their mannerisms while they're describing it, the actual very specific, very nuanced, symbolic ways they're describing it. A lot of times it smells, it sounds, that all appears in genuine accounts, and it's something that people really get wrong when they're feigning.
I'd love to see how Amber Heard described her symptoms of PTSD. Yeah, maybe, I know she's an actress, Rosebud. Yeah, I mean, yeah, with her histrionic personality disorder, probably all theatrical, being an actress, I can imagine that would be, it would be quite hard to put your finger on it if you're not a psychologist, wouldn't it? You know, you'd be like, well, it sounds like bollocks. But this test can actually prove that it is bollocks. So there you go.
In addition to your conclusion that Ms. Heard does not have PTSD, did you make a conclusion with respect to her symptoms?
Yes, actually I did. So, just because somebody doesn't have PTSD doesn't mean that they weren't harmed psychologically by whatever is being alleged. In this case, Ms. Heard is alleging that she was psychologically harmed and that she suffered PTSD because of abuse that she alleges occurred by Mr. Depp. So the MMPI too is helpful because it shows you kind of everything, any other symptoms. And then in Ms. Heard's own self-report and her prior treatment records, I knew that she had reported to me that she had had some other symptoms. So now what becomes really important is determining, and let me clarify one thing here, not so much a diagnosis, but did she start to experience symptoms during the relationship and after? Did they worsen after? Or could these types of symptoms or reports be explained by other factors? A, by feigning, B, by pre-existing conditions, or C, by other stressful life events that might have occurred. So the main symptoms that I was looking at didn't meet criteria for PTSD, right? There was also substantial evidence of this sort of emotional dysregulation, emotional disorganization, the shallowness, the dramatic affect. Now, when you have a lot of childhood trauma, you can actually have some similar type presentation in adulthood. There are some differences though, but also that's not something that would have occurred after this relationship. So now I was looking at, are there indications that these types of things that she's described, this transient anxiety, the issues with sleep, were these there prior? And sure enough, Ms. Heard, in her own self-report, stated to me that when she first got to LA, she was seeking treatment for, in her words, blanket anxiety and depression. She also reported that she was taking medications. In general, none of them were helpful. That's actually very typical of borderline personality disorder. Medications typically aren't very helpful for somebody with the disorder. They really need an intensive, lifelong type of therapy, which is not necessarily as relevant to this. But interestingly also, people with borderline personality disorder often respond really positively to stimulant medications that are given for ADD or ADHD. And in one of Nurse Filati's notes, she reported that Ms. Heard told her that none of the medications were working for her except for one Provigil, which is often prescribed as stimulant medication. And I just thought that was interesting and sort of consistent with more of these lifelong personality disorders that aren't necessarily caused by a harm by any allegations, but have been there and will remain there typically. The other issue, so the anxiety, she had already indicated that had been there prior, but the form of the anxiety. So looking at Dr. Hughes's testing and then also looking at the scores on the MMPI, when you look at all these little combinations of the scores, you can actually learn a lot about, is the anxiety related to an event, or is this more a person who tends to be an anxious person regardless of what's going on in their life? And somebody might describe them as a worrywart. And the scores, the little combination of scores that she obtained actually indicated that it was the latter, that her anxiety tends to be separate from events and more just kind of a constant, and it comes and goes, but it's more of a trait.
I have no further questions for this witness.
All right.
Yeah, why would you? I mean, what else do you need to know? Yeah, covered all the bases there. I think I'm going to go out on a limb and say Amber Heard is a shallow, manipulative, deeply disturbed woman. And Johnny Depp is God. No, Johnny Depp's got his own problems, but Amber Heard, yeah, wow. She's going to need some wild evidence to come out very, very soon. Or she's screwed.